Here, I'll read them all for you.
Thank you.
Okay. We're going to do palpations first. Thoracic transverse process T1.
On your stomach, please. I can ask. Okay. Thoracic spinous 1. Can I have your shirts off, please? Your shirts off.
Ooh. Both of them?
Yes, please.
Stud.
You may lay it on the table so it's warm for you, okay? You can lay it on the table so you're warm. Okay, so whenever you have a patient, you can do this to yourself. Run your finger down your own cervical spine until you feel a gigantic bump. That bump is C7. So when you look at that, that's a good indicator of where we are. So if someone's laying down, you're going to palpate until you feel this bump, okay? Some people will ask their patients, can you do me a favor, Mike? Can you put your head, like, look at me. Okay, what you're going to do is you're going to come up on your elbows, you're going to put your head down for me. There you go. Can you see that bump right here? Okay, that's C7. So right here, this is T1. Okay, why don't you guys come up with your camera so you can take a peek. Okay, cervical spine, C7 to T1. Okay, so I'm going to have C7, I'm going to have a space for my intervertebral disc, and then I'm going to have T1. Space, T2. Space, T3. Space, T4. Okay, and this is how you do it. Okay, when you're counting down. Okay, where they are. Okay, here he's got a little bit of scoliosis going to the side. Okay, we'll talk about that as time goes on. So relax down for me, lay flat on the table. Okay, here we go. So I'm at thoracic spine 1, okay, spinous process. So here I am. Okay, there it is. What's next?
Supraspinous ligament.
Okay, supraspinous ligament is going to sit between the two vertebrae. So here is T1 and here is T2, and it's going to sit right between the two of them. Okay, so this is where it is. Next. Costovertebral is where my ribs come in and they meet into my actual junction. Okay, so I'm going to come down a couple spinous processes. So I'm coming down to this one right here. My rib will come up and it'll attach right in here. Okay, so when I'm right here, okay, that's one. Right here, this is one. He's going to be a little tight because he is a golf player. They tend to be very, very tight in this junction, and he is. Okay. My next one is my trapezius insertions. Okay, there are 3. My first one is here, my second one is here, and my third one is here. Okay, so those are 3 aspects. So the one I'm particularly looking for is this one right here. Okay, so origin to my insertion. Next one is origin to my insertion, origin to my insertion. Okay, where was I? Any spinal muscle. You can tell me any one. You may tell me my quadricep, my quadratus lumborum is here. You may tell me that I have lat. You may say that I have rhomboids, minor and major. I mean, it's up to you. Whichever one you want to do, you can do. I could care less. Okay. Next thing is my scapular muscles. Okay, actually that one's on there. I apologize. You can't use this one. Rhomboid minor, rhomboid major. Okay, and look at where they actually sit. They sit right along the side of my actual spine, attaching to my scapula. Next one is my lumbar process 1. So from here I got to count down. So this is going to be my C7, T1, T2, T3, T4. He's crooked.
Sweet.
He's anterior, okay? 4, 5, 6, 7, 8, 9, 10, 11, 12, 1. If I want to double check, I'll continue on. 1, 2, 3, 4, to my 5. So I know that where I'm here, this is going to be L1. So this is lumbar spinous process 1, intervertebral space 2, intervertebral space 3, intervertebral space 4, intervertebral space 5. Okay, and that's spinous process of L5. Next one is a step-off deformity. He did have one. It was right up in here. Okay, so I feel spinous process, space, and then I kind of have to dig around because that bone is sitting anterior, sitting down. Okay, that's what we talked about there. So other things, 3 erector spinal muscles. So we're going to have our spinalis, which sits from spine to spine to spine all the way up. We're going to have our second one, which is going to be our iliocostalis, so it comes all the way up. Okay, from here, from my ilium, okay, all the way up to my ribs. And my last one is going to be my longissimus, which sits right in the middle, okay, and it'll come up into here. So it's kind of where my transverse processes are. Not only in the middle, but there's one on the side, and of course the other ones. Okay, so there's three of them. Spinalis, longissimus, and iliocostalis. Paravertebral muscles are the ones that are multifidi and are rotatoras. From kinesiology, some of you may remember that the rotatoras can go 2 to 4, and 2 to 4 is multifidi, and rotatoras is 1 to 2 coming down. Okay. Next one is median sacral crest. I'm going to pull up your pants. Okay. So as we're here and I get down into his sacrum, palpate it. Okay. So here I am. This is number 1. This is 2, 3, and 4. Okay. So I'm not going to go further than that. Okay. So make sure you are palpating. Next one is my iliac crest, easy for him. I kind of come in on the side until I feel a bone. This is his iliac crest, and I can feel it all the way around. Okay. Next is my PSIS, easy for where I am now. I'm going to follow this iliac crest all the way back until it meets into my SI joints. Okay. Right here, it's the big bump that we feel. All the way around until you feel the bump. Okay, and there's the bump. If I want to find on the other side, same idea. I find my iliac crest, I ride it back until I find my bump. So here are the 2 bumps that I have. Okay, they're both my PSIS. The one that's a little bit lower is the inferior. Okay. Okay, I'm going to skip ahead. Okay, we're going to have glute max, which is going to be in this area right here. Ischial tube, this is easy to find. I'm here to my greater trochanter. I'm going to come halfway through and I'm going to palpate. Okay, and what I'm going to do is, if he can relax, thank you. Okay, right there. That's my ischial tube. Okay, greater trochanter. I'll show you that in a minute. Sciatic nerve runs through my greater sciatic notch. Okay, and comes down. Okay, my ischium, which is my ischial tube. I just touched that, and of course, this big bone right here is my sacrum. It's usually 5 vertebrae that are fused. Okay, so what I need you to do is I need you to lay sideways, and you can put your shirt back on.
I'm stuck on the table.